Hi team, my name is May. I am one of your night charge nurses, and I am working with Brianne, who is actually filming this right now, and she is one of your day charge nurses. And so we are making this video about how to set up suction, just because it's been something that has been coming up lately. So we want to just show you the proper way to set up suction, when to get rid of it, you know, how to keep it covered, and then also as far as where to go find all the supplies. So between Brianne and I, we'll kind of start this and show you how to get everything set up for a room, okay? So the first thing that we want to do is you always want to make sure that you have this setup right here. So this setup, as you can tell, if you needed to move this or remove it, you just have to push this button in right here, and this will let you hook it up to the wall, and then it's set up. And then as far as this particular piece, which is just the white plastic, it just slides up and in. So if you don't have this, you'll just want to take it, slide it right in here, and then you have that set up. This pink tubing should be set up on here, but if it's not, this will need to come from clinical engineering. And so if we don't have this piece, you'll have to talk to your day charge nurse or the night charge nurse, and then they'll go ahead and place the work order so that they can provide that for us. Then you'll have this red tubing on the top, as you can see right here. The other part is that this pink one will actually hook up to the vacuum regulator. So for a vacuum regulator, if you don't happen to have one, you'll want to make sure that the regulator matches up to these two holes. So you can see that there's two pieces here, and they go into their respective openings. So you'll want to remove it, you just push this button and it'll release it. Otherwise, you just place it in here, push kind of hard, and it'll actually hook back up, okay? This particular vacuum regulator, you'll see has continuous, off, and intermittent, and you'll want to test this as well. You typically want to stay in the green. For pure wicks, we can go here as high as 80. And same with suctioning. If you're suctioning someone for some reason, you'll also want to make sure that you stay around 80. The yellow is the highest you ever really want to go. Otherwise, I think it's respiratory that deals with the rest of that. So to test this, you'll always want to make sure that you push it off to one side. You can hear that it's obviously working. And you can see that the needle went up to the top part of the green right there. Then we could turn it off, and then to test our intermittent, to make sure that this does work, all you do is take this part, just put a little pressure or cover, excuse me, and you can see that the pressure goes right up, okay? All right, we'll put that on off, and then to actually change the pressure on it, excuse me, so to change the pressure, you just turn the knob so that you can change the pressure on the vacuum container or the regulator. All right, so once you know that you have all of that working and it's all set up, the next thing you want to do is you want to make sure you have an empty canister, and this is where you're going to mark at the end of every shift or every 4 hours. You should be marking where the last measurement was that you took. Okay, so you always want to make sure that this is facing outward when you actually slide this in, so that it's easy to mark. Okay, then with that you have your lid and your tubing, and you also need your yank hour. Okay, so just make sure that you get the yank hour, which is the hard plastic piece that you'll use to actually suction the patient with. And then we'll also have our plastic bag that we're going to use to cover it all with. So once you have that set up, so we're just going to place this lid on here. Okay, make sure that it does snap, because if it doesn't snap, and you probably heard that clicking, then if you were to go lift it up, it's all going to the lid's going to just come right off. So you just want to make sure that it's all snapped up, okay? So then you'll want to make sure that, if you can tell, there is an area here, it says vacuum. This one says patient, and then over here it says ortho. Ortho doesn't typically apply to us. So we'll put the red piece here set up to the vacuum, And then where this little plastic piece is set up right now, you want to make sure that you have that one, and then you'll put the blue piece over here on the ortho one. Then you want to place this white end, and it doesn't matter which end, just as long as it's one of the white ends, because there's two. Place that one under the patient. Then you're going to want to take your Yankauer and make sure that you're opening up the end that actually hooks up to the tubing. Please don't open up the end that actually is going to go into the patient mouth. So you're looking for the part that actually will hook up into the tubing. You'll hook that up in there. You'll actually place this whole thing together. Okay, then what we'll do is we're gonna take our bag, and we want to make sure that we are covering this from the bottom. Now, once this is covered and all set up, the one thing that you need to know about this is that once this is covered, this means that this whole setup is considered clean, okay? So if you use it for any reason, or this is off, and we want to start from the bottom too, start from the bottom up and then tie it at the top, that if for some reason this is off, this is then considered dirty. And then that means that you'll want to make sure that you get a complete new setup for this, okay? And with all those exact pieces, or make sure that all these pieces are there, okay? So this is a complete setup. Now, if you're using this for the PureWick, if you're using it for any type of, if you used it for any type of suction whatsoever, please make sure that you're disposing of the canisters, okay? And after each patient, if it was used and this plastic piece was removed, please discard it and put in a brand new setup, okay? So that your next patient, as well as the next nurse, next NA, is prepared and ready to be able to do what it is that they need to do, okay? So it doesn't matter also, it doesn't matter how much is in here, we just want to make sure that we have a clean setup for the patient. So if there's only 10 mLs, please throw it away, don't just cover it back up, okay? Anything else that you can think of, Brianne?
That looks good. We just want to emphasize it's a shared responsibility, and also when you're setting up the room for a new admit, that's kind of your final double check and chance to set it up. But if it happens to not be set up and you already have a patient in the room, that we will make sure it's set up then as well, so that it's ready in case something happens with the patient. There's been a lot of like urgent or emergency situations where we've needed it right away, and so that's the importance of using it.
Excellent. Okay, I hope this helps. If you have any questions, please make sure you check with your charge nurse day or night, and then that way we can help you with the setup. Like I said, we're also going to show you where to add on to this video and show you where to find all this equipment, so that that's also not an issue, because the regulators are actually found in a cabinet, and then the rest of these supplies should be found in the clean equipment room, so or supply room, excuse me. So we will let you, we'll add on to this video, and hope this is very helpful to you. Thank you so much.
Hi everyone, I'm going to show you where to get the suction regulators. So this is the cabinet that's between 5677 and between 5678, labeled suction equipment. We have a key at the charge desk to unlock it. Also, a lot of the staff have the keys that were used from the nurse servers, so you can use those keys to unlock it. So in here we have the extra suction regulators. We also have the bags that cover the whole suction setup. So this is where you will find those pieces. We're hoping to also get some extra pink and red tubing and the white part that hooks up to the suction, so that those will be in here as extras for you guys from clinical engineering. Hi everyone, so I'm going to show you where to get the suction supplies in the clean supply room. So there's 3 things that you can find in here. The actual suction containers, and the suction canister lids, which has the tubing and the blue lids, and then the yank hours. So these pieces are all together on this shelf here in the clean supply room.